Hello, everyone. I'm Carolyn Cumpsty Fowler from the Johns Hopkins University and the Johns Hopkins Health System. And today we're going to start our conversations about collaborative program planning with an introduction to the Multi-Sectoral Influences Matrix, or MSIM. Before we jump into that topic, I'd just like to welcome you and thank you for your interest in injury and violence prevention, and specifically in collaborative program planning. For those of you who don't know me, I've been a faculty member of the Johns Hopkins Center for Injury Research and Policy for many years, first as a full-time member and now as an adjunct faculty member. And in that role, it was my great privilege to teach the Summer Institute Principles and Practice of Injury Prevention for more than 20 years. And so many of the things that I'm going to share with you in this series are ideas and concepts that I've presented to many injury prevention professionals over the years, that I've honed with their input and feedback, and that I've had the privilege to share with our Safe States community for 20-something years now. So I hope you'll enjoy this time with us and that you will be able to use the ideas that I share with you in the area of injury and violence prevention practice that is your primary responsibility. So let's get going. One of the questions I often ask people at the beginning of their careers is, what do you think the most important injury and violence prevention skill is? And full disclaimer, actually, I ask public health professionals this: what is the most important skill that you'll learn? And this is my answer. And as a complete disclaimer, this is my personal opinion based on my practical experience. But this is fundamentally what I believe at my core, that the most important skill we ever learn as injury and violence prevention professionals is to learn how to ask the right questions. And obviously, we have to ask them of the right people at the right time in the right way. And this comes with a related behavior, which is listening to the answers with humility. Listening to understand, not to confirm our assumptions or prove what we believed starting out, but to listen to learn, and to listen with a beginner's mind. A beginner's mind is a lovely concept. It's the idea that we see everything fresh every time we look at it, and that while we may have experience and expertise, we don't lead with that. We lead with curiosity and humility. Now, although that was my assumption, and that's what I've been telling students for 25 or 30 years, Edgar Schein, who's a giant in the world of organizational psychology, coined the term humble inquiry back in his book, Helping, in 2009. And subsequently, he's written books on humble inquiry, 2 editions actually, and I'd recommend those to you. And Dr. Schein defined humble inquiry as the fine art of drawing someone out, of asking questions to which you do not already know the answer, of building relationships based on curiosity and interest in the other person. Now, obviously, this focus is more individually focused in terms of this definition, but it dawned on me many years ago, but then finally I defined it in 2015, that there is something really important in our field, and that's multi-sectoral humility. And I define that as a commitment to others-focused inquiry and learning. It requires willingness to accept that multiple sectors and stakeholders influence any situation we hope to change, question assumptions, discover our cognitive and emotional blind spots, ask the right questions of the right people, and listen with humility to what we learn. And I really encourage us as we step into this world of injury and violence prevention to really sort of reject the idea that any of us can ever be culturally competent, because we can't. Things change all the time. And instead to embrace this idea of multi-sectoral humility, where we genuinely learn from the people we're working with. Now, why is multi-sectoral humility so important in injury and violence prevention? Well, I'm sure you could add to this list, but the first is that injury and violence prevention issues are complex. They're etiologically complex. They're in a socio-political environment that is very complex and very changing. And of course, there's interventional complexity, because if an injury issue is complex, a simple one strategy solution, such as a simple educational campaign or a simple reminder about something, a simple enforcement strategy, is unlikely to be effective. And at Safe States, there is a real commitment to embracing the complexity of injury and violence prevention issues and the responsibility that comes with that to look at more evidence-informed and comprehensive programming. Now, of course, we have incredible resource challenges in injury and violence prevention, both in terms of human skills, human capitals, and just the partners that are available to us. And of course, we also have financial and technological challenges sometimes. But then, and this is something I would like to present to you as the glass half full of injury and violence prevention, we have so many unidentified opportunities that can accrue to us if we are willing to work collaboratively. And those are resources, both human resources and money and skills and technology and political capital and all sorts of resources that we can only imagine. There are so many opportunities for non-traditional partnerships to address injury and violence issues. And finally, there are opportunities to find shared interests and cross-cutting benefits so that our work in injury and violence prevention may also have benefits for the public's health and well-being. All right, well then, that's great in concept, but how do we identify which questions we should be asking about the injury issue that we hope to influence, as well as the context in which that injury issue is arising? And one of the tools that we use in public health a lot is a conceptual framework, which helps us organize our thoughts and our data. And the one that, of course, I'm introducing you today is one that I developed called the Multi-Sectoral Influences Matrix. You'll see by the logo that it has a Creative Commons copyright, but as long as you give some attribution, please feel free to use it however you like. Now, before we dive into using the MSIM, let me tell you a little bit about where it came from. And here I want to give homage to people who have gone before me and to colleagues who stimulated my thinking around this. So the foundation that MSIM rests on is two frameworks: the Haddon matrix, of course, William Haddon's wonderful matrix that we use in injury prevention all the time, and then the social ecological model, which looks at layers of influence in the social environment. But the real inspiration for me to develop the MSIM came from people who were taking the Indian Health Service's Injury Epidemiology Fellowship. It was my great pleasure to work with them over several years, teaching injury prevention coursework, and specifically intervention design and evaluation coursework. And what became very clear very quickly was that the Haddon wasn't working well. It was very good for an acute injury issue. But when we thought about, well, how do we intervene on an injury issue within a community, it became clear that sometimes the social piece of it was pretty complicated. And what I learned from my colleagues in the Indian Health Service was that in some of their situations, different people controlled different parts of the story. So certain people controlled certain roads, other people controlled other roads. Some federal policies might apply, local policies, policies from the nation that was working on this themselves. And so it became very clear that we needed another instrument to think about who we should be working with in order to really move injury prevention issues forward. I also felt that the social ecological framework was a little limiting, because in one layer, such as relationships, there are so many of them. There can be so many different groupings and so many different stakeholders. And so this was the motivation for designing it. And I just want to say that, it didn't look like this when it started out. It's always been similar to this, but I've been using the MSIM for probably 15 years now. And each time we've used it, and I've used it with injury prevention people, with public health students, with nursing students, with nursing leaders, with community groups, and in academic settings. And in each time I've used it, people have helped me see it differently and to improve it. And so the form that I'm going to introduce you to now is something that really is a collaborative tool that has benefited from the feedback of literally hundreds and hundreds of people over the last few years. So let's dive in. The MSIM is a grid, as you can see, and it has 3 phases, kind of like the Haddon, but they're different in orientation. So the MSIM has a historic phase. It has a current phase, which examines the status quo, and it has a future phase, which is really about what are the considerations that we should bear in mind as we think about an intervention and its ability to move forward into the future. We have overarching and phase-specific issue statements. So the overarching statement is the statement of what it is we're trying to understand with our analysis. And the phase-specific issue statements are the issue statements related to the past. What is it that we want to understand from the past? What is it we're trying to understand currently? And what are the things that we're trying to understand as we plan for future work? There are multiple levels of social environmental influences, and they can either be broad sectors, so we could include, for example, police or EMS and fire, traffic engineers, schools, things like that. We could have bigger groupings, or we could really break them up into individual stakeholders that we're working with. And what I want to say about this is entirely customizable for you. You put the people into these layers that make sense for you. We then include an option to talk about physical or built environmental factors. And this is very important, especially as we think about issues of structural inequity and institutional racism, where there are differences in access and differences in the quality of services that are provided. So perhaps think about what the physical variables are here. And then there's also an opportunity to talk about either the product-related factors or policy-related factors. And once again, these are all customizable. So this is a tool that you can tailor for your own environment. So let's jump in and see how we would do this in terms of sequence. Here's the blank MSIM, and let me say right up front that most people who use it end up putting this into an Excel spreadsheet, because then that allows you to add multiple columns to the stakeholder group. And even though you'll see that there are 5 levels of social influence, most people say, why? I have to have 5 levels of influence? And then the more experience they have, the more likely they are to say, gosh, well, we've got 10, 15, 20 layers of influence. We have people who are primary influences, and then people who are more secondary influences. You know what? That's fine. Knock yourself out and do it whichever way you want. But the most important thing to understand is that when you start, you're going to start by stating your issue. What is it that you're trying to understand? Are you, for example, trying to understand how alcohol is distributed in a community? Are you trying to understand what a community thinks about how to respond to a specific issue of violence in the community? It's very important that you get that definition correct. And if it turns out that it's not working for you, change it. But at least scope out what it is that you're trying to understand with this analysis. And then when you've done that, look at your phase-specific statements. So, for example, if you're working on intimate partner violence screening, for example, in the historic phase, you might want to say, I want to understand what historically has happened in this environment with regards to intimate partner violence screening. Is there a history? What have people tried? What have they not tried? In the current phase, you might be asking, well, what is currently in place? And what are the current attitudes and commitments towards intimate partner violence screening? And in the future phase, you might be saying, and if we were to implement intimate partner violence screening protocol, what would we need to know in order for it to be acceptable, sustainable, and effective in this community? So once you've done your issue statements, you then think about, well, who are my stakeholders? Because remember, the stakeholders are related to the question. So in this case, you might be saying, well, if I'm trying to understand intimate partner violence in a community, who are the stakeholders here? They may be different members of different agencies. They may be victims groups. They may be perhaps even people who've opposed it. We don't know. There's a lot to learn sometimes from people who've opposed it. And so brainstorm, who these stakeholders are. And my experience with this, colleagues, is that we start with a few that are obvious to us. And then as we begin to ask more questions, we get a better sense of who else we might need to be asking questions of. So once you have your stakeholder groups, you're going to start populating your matrix with questions. Now, early on, we didn't do this. Early on, we started populating the matrix with things we knew about the issue. But here's the challenge. We were populating it based on what we knew or we thought we knew our stakeholders were doing. So we might say, well, this is what the community believes, or this is what parents think. But the reality is that wasn't very curious and it wasn't very humble, because we were making assumptions about what those stakeholders thought, believed, or prioritized. And so what we do now is we use the MSIM to generate questions. What are the questions you have for the different stakeholders? What are the questions that you may have easy answers to, and what are the questions that you don't have answers to? And here's the real piece of this. Sometimes we don't even know what questions to ask. And as we delve more into the analysis, we realize that there are people that we need to partner with in order to even know which questions we need to ask, right? Sometimes we don't know what we don't know. And so then we start with our questioning in the current phase. We start in the status quo, and we ask the questions here about the factors that have influenced the status quo for this sector or this stakeholder. So if, for example, one of my stakeholders is the local health department, I might ask, well, what are the factors that are influencing where we are today in the health department's perspective? And which of these are modifiable? And don't assume that there's consensus about the need to change. You may have stakeholders who really want change, and you may have stakeholders who really would prefer that the status quo stays where it is. And so this is about asking lots and lots and lots of questions of stakeholders. Now, once we have the questions for the current phase, then we need to look at the history. And I cannot emphasize for you enough how important it is to understand the history of your issue. How did this sector or this stakeholder get to where they are today? What is the history of this problem? Is there a history of previous attempts to address this or similar issues? Don't assume there's no historical baggage. So, for example, you may have two communities. One community has never attempted intimate partner violence screening before. The other attempted it maybe 10 years ago, and something went wrong and they had a bad experience. Perhaps somebody was overheard talking about his or her experience and was subsequently injured by the partner. Those communities, one that has no history and one that has a history where they rejected the idea of screening, are very different environments if you're trying to reestablish screening now. And then as you move forward, what is it you've got to think about? Now, this is the phase that requires the greatest discipline, because I think what happens here is people tend to populate this with the ideal questions. It's going to be wonderful. Everybody's on board. It's going to be fantastic. And I have observed students for sort of 15 years struggle with this phase. But let me tell you what this phase is about. It's about anticipating what may influence acceptance, effectiveness, sustainability, and what can we do in the current phase to anticipate and plan for opposing forces, resource challenges, sustainability challenges, and so on. So, for example, if we're planning a policy, we shouldn't get to a place where we're presenting our policy argument and have people say, well, did you think about this or did you think about that? And have it surprise us. This is the discipline which says who would likely oppose it and what would their rationale for opposing it be? If people oppose enforcement, what would their rationale be for opposing enforcement? What would their rationale be for opposing the investment of resources? This is the discipline we need to think about what we're facing as we move into the future. Now, the other thing I'm going to say is that the direction of the questions we ask influences what we learn. And this is really important because very often, if you think about it, we tend to focus our questions on what's missing, what hasn't been done, what the problems are, what's not going to happen, right? I mean, let's just be honest. It's our humanness coming to the fore here. But there are so many things that we could learn if we also asked the positive questions. What has been tried? Who is engaged and committed? Where are the resources? Where's the social capital? Where's the social influence? Are there other things we've done in this community that may be different, but they're similar enough that we have some trust established with the community? You know, who are the experts? What are the opportunities if we partner with them? So please try to include some positive questions in your assessment. And the reason for this is really pretty important. If we only include deficits questions, we're going to identify relatively few strengths and opportunities. If we identify more strengths and opportunities, more assets-focused questions, or more strengths and opportunities-focused questions, then we're going to find more strengths and opportunities. It's not to say that we won't see problems and there aren't deficits. Of course there are. But when we ask questions on both sides of that equation, we're likely to get a balance of challenges and opportunities. Now, you may have heard by now that I encourage collaborative completion of the MSIM. And the reason I do it is there's lots of reasons I do it, but here are a few of them. The first is it encourages humble, inquiry-focused conversations. When we bring our partners in to understand a situation with us, then our conversation is less about proving what we think and more about really discovering what we all know and what we all think about it. It yields different perspectives and insights. And Dr. Shakila Smith did a wonderful talk for this series on adaptive leadership. And this is the type of strategy which can help you sort of get on the balcony, which you'll learn about if you watch her lecture. This is about stepping back from your worldview and the way you view the world and really getting a broader view of what's actually going on in your community. And it helps us all challenge all of our assumptions. Now, the way that I often do it is not to sit there and plug it in boxes. I often will just do brainstorming with Post-it notes. We stick them up on the walls. We ask each other questions. We ask, you know, is there somebody that we should be asking questions of who's not here? And it really involves people from the beginning, the very beginning of the process. Now, the other thing that I want to say briefly here is that you can use MSIM at the beginning of an assessment when you don't really know anything about the injury issue. So you can use it early on to understand what's going on with this issue in our community. However, once you've decided what your intervention options are, you can also use it again to think about what are the opportunities in your community that could support you rolling out a more comprehensive response to the injury and violence prevention problem. So it's up to you. Please make it your own. If you'd like to see a webinar, a recorded webinar, on how a community has used the MSIM in Safe State program development, that webinar is available for you on the Safe States website, and I've included a link. In that webinar, I provide an oversight of the matrix. Marissa Yellman provides a discussion of how she thought about using the MSIM sort of theoretically in Safe Sleep. And then our community partners described how they used it for real in a community setting as they were talking about Safe Sleep. So I hope that if you're interested, you'll have an opportunity to watch that on the Safe States website. This may feel very foreign and very different for you. It's not our usual way of thinking, where we just sit by ourselves and figure it out. But I hope that you will view this as an opportunity, not necessarily to go to different places with your injury prevention work, but to have new eyes as you think about the opportunities in front of you for evidence-informed injury and violence prevention. Thank you for joining me.